Dear Emily O'Reilly.
Further to our complaint 174/2015/4, where you remarked the Commission should continue to evaluate new scientific data relating to the safety of PIP implants. We are writing to inform you that the Commission separated our concerns and made calls for information on PIP implants and breast implant cancer, a step they said was necessary to assess whether new evidence was available for evaluation.
PIP Action Campaign submitted over 70 relevant full-text peer-reviewed papers which had not been included, all published at the time of the 2014 Senate report in response to the PIP implant call for information, and submitted them in zip files to the SHEAR Secretariat by the deadline date.
This was by no means an easy task. Full-text, published research papers are usually only available through subscriptions to medical journals intended for health professionals and usually involve substantial subscription costs. Nevertheless, with the help of concerned health professionals, chemists, pathologists, toxicologists, regulatory experts, medical researchers, surgeons and doctors, we were able to submit a large number of relevant peer-reviewed papers in the format required by the committee and in accordance with the rules of procedure governing the SHEAR committee.
We also compiled our own data based on information shared by our members and produced a document which referenced our member health survey and other documents such as individual doctors or surgeons' case notes, reports by the Dutch Public Health Authority, RIVM, and publications from the ANSM, the French competent authority responsible for the collection of the most comprehensive evidence available based on 30,000 PIP removal surgeries in France. We call this document PIP Action Campaign's Real-World Evidence. Our document was fully cited and referenced, and we sent copies to you and to Ms. Evans at DG Grow, who forwarded our document to the SHEAR committee.
Just over a year later, we were informed by email received on the 27th of October 2017 that our submissions had been dismissed by the SHEAR committee.
In February of 2017, as we waited for the publication of the SHEAR report, we were informed by EU Health in a tweet there had been a delay in the publication of the report because more work was needed. We were encouraged at first that the matter was to be addressed by health rather than business at the Commission, and then appalled when, after a very long delay on the 27th of October 2017, we were informed in the case of PIP, the SHEAR committee found there is new evidence, but that it is insufficient evidence to justify a review.
We were also shocked to learn that the breast implant cancer call for information had also been shrugged off by SHEAR. PIP implants are implicated in BIA, ALCL deaths, with one of the most highly implicated brands, Silimed, closely resembling PIP2 gels.
It seems the European Commission has failed to grasp the seriousness of non-compliant Class 3 medical devices and the consequences to women.
These horrifying self-referenced conclusions from SHEAR and SENIA have the direct effect of imposing unnecessary and prolonged suffering on sick and vulnerable women by undermining and obstructing access to care, diagnostics, treatment, research and future monitoring.
In the UK and Ireland, women have not been advised to remove their PIP implants, and many women still have them. It is well known that contaminants found in PIP are endocrine-disrupting chemicals, recognized as reproductive estrogens by REACH. HISHA has conducted 2 public consultations into D4 and D5. The first result in a proposed ban on these chemicals in shampoo and other wash-up products. Among Germany, along with a number of NGOs, including Breast Cancer UK, argued in an open letter simply did not go far enough.
PIP Action Campaign prepared and submitted a substantial dossier on D4 and D5 to the first consultation. Sadly, but predictably, the second consultation did not include health effects of these regulated PBT and VP/VB substances.
Indeed, Sweden also identified the Commission's inertia on the matter of chemical exposures to EDCs and took the matter to the European Court of Justice, which ruled against the Commission and its delaying tactics and took action to protect citizens from harm.
Still, with the Chemical Council spending as much as €12 million annually on lobbying, perhaps the reasons for the failure to recognise toxicity of PIP contaminants is the same reason 2 public consultations were necessary. The industry is opposed to their regulation.
Chemical exposures are issues of particular importance to women exposed to PIP implants, the majority of whom are of reproductive age. Many are mothers, some have been pregnant and breastfed with leaking and ruptured PIP implants.
There is no safe level of EDC exposure for a developing embryo or breastfed infant.
Chemicals are an essential component of our daily lives, but some chemicals, known as endocrine disruptors, can have harmful effects on the body's endocrine system. Hormones act in very small amounts and at precise moments in time to regulate the body's development, growth, reproduction, metabolism, immunity, and behavior. Endocrine disruptors interfere with natural hormone systems, and the health effects can be felt long after the exposure has stopped. Exposure to endocrine disruptors in the womb can have lifelong effects and can even have consequences for the next generation.
The xenoestrogenic effects of the contaminants are also of concern to recovering breast cancer patients with estrogen-positive malignant tumours.
With so much evidence of harm being overlooked, we have begun to recognise regulatory capture in medical devices regulations at the European Commission. Regulatory capture is a pernicious and extremely dangerous form of healthcare corruption, where regulating authorities put the interests of the manufacturers before the safety of the patients.
As time goes by, the evidence of regulatory capture is growing.
In 2016, RIVM, the Dutch Public Health Authority, carried out a surveillance review of implant manufacturers' technical dossiers and made several extremely worrying findings. That the 10 manufacturers with CE marked Class 3 breast implants available in the Netherlands, all 10 had incomplete and/or inaccurate technical dossiers. This means all 10 manufacturers are non-compliant with current medical devices regulations and the notified bodies. Competent authorities and the European Commission are aware of this.
Meanwhile, the SNEER report has become a key reference and tool for undermining new evidence on PIP and other brands of implant. The 2016 RIVM surveillance report dismissed dangerous D4 and D5 levels and concerns over non-compliance with one sentence. I quote, "According to the recent SNEER opinion, silicone breast implants, this is well below levels of toxicological concern. So although it is a shortcoming, it does not raise its concern for patient safety."
Non-compliance with regulatory requirements puts patient safety at risk. Technical documentation is required to be accurate and complete for medical device manufacturers to legally affix the CE mark. Article 8 of the Medical Devices Directive 9342 EEC refers to mandatory safeguard actions that includes the failure to meet essential requirements in Article 3. Patient safety is a priority of the regulations, and non-compliance is the first sign patient safety is at risk.
Also in 2016, the ANSM, the French medical devices regulator, asked a committee of experts to review biocompatibility or safety of textured breast implants available in France. The expert committee concluded there is no safety data for textured implants, including PIP.
Biocompatibility or safety evidence is another of the essential requirements of Annex 1, 93/43/EEC of the Medical Devices Directive and absolutely critical to patient safety.
The French regulator, the ANSM, gave manufacturers 12 months to produce the safety data for textured breast implants.
Incomplete and/or inaccurate technical files and no biocompatibility data for textured implants should be of serious concern to the Ombudswoman. This is clear, irrefutable and easily verifiable evidence that non-compliant textured breast implants, like PIP, were knowingly on the market bearing a CE mark. In fact, this is evidence PIP was not fraud at all, but business as usual for the Commission, the notified bodies and the breast implant manufacturers.
In 2001, the European Parliament produced a resolution on silicone implants following 2 petitions.
In 2003, 20,000 women signed a petition addressed to European Parliament, Annex 2, with clear intent to make breast implants safer. As far as we can see, none of Parliament's recommendations were acted on or implemented, even though breast implants were reclassified, at the request of the French and British authorities, from Class 2B to high-risk Class 3 devices.
By 2011, women with PIP were dying from breast implant cancer.
In 2016, the European Court of Justice in the case of Schmidt v. TV Reimann ruled that notified bodies required by the regulations to ensure for public liability may be liable in the event of negligence. The evidence from PIP not only points to flaws in medical devices regulation, but endemic failures at every level in the European system of regulation of medical devices. Every citizen needs to be able to rely on the safety and efficacy of medical devices and in the assurance provided by the CE mark. It's all too easy to ignore the evidence, name a public health crisis a fraud, and produce reports to undermine the seriousness to the health and well-being of patients. Denial, albeit cheap, is an inappropriate and unacceptable response to a public health crisis. In 2016, and again in 2017, PIP Action Campaign wrote to the Commission to insist on safeguarding action to protect patients from non-compliant implants and recommend removal to women with PIP.
The pattern of inaction is dangerous. PIP was not a fraud, but the inevitable consequence of the Commission's failure to act on repeated resolutions of the European Parliament and the concerns of injured women, raising petitions via the Parliamentary Petitions Committee.
More than 100,000 women and their families in the EU have been harmed by banned, non-compliant PIP implants, and many more exposed to non-compliant textured implants.
Initially, we considered requesting our complaint be urgently referred to the Committee on Petitions to initiate infringement proceedings against the Commission on behalf of all women exposed to and injured by PIP and other textured breast implants. However, we see this as a route that has been tried before with no effect.
We are deeply grateful to you for your concern for women to date, many of whom are mothers, and of course women who have battled breast cancer and to have undergone major reconstructive surgery. We ask you now, in the name of all the women in the EU and worldwide, suffering as a consequence of non-compliant implants bearing the CE mark, and on behalf of all the women who have suffered from ruptured or leaking PIP implants, such as Susan Grieve, a young mother of 2 from the UK, who died from BIA-ALCL breast implant cancer, and ruptured PIP implants in 2012, to assist us in initiating a legal claim against the Commission and the CE mark in the European General Court or the Court of Justice.
We wish to assert our rights to access to information, diagnostics, healthcare, treatment, research and future monitoring for ourselves and our children, and on behalf of all other patients, doctors, clinics and hospitals relying on the safety and efficacy of a CE-marked Class 3 medical device. We wish to defend our basic rights as citizens, as women, and as victims of the crimes against us. And we demand our protections under Article 152 of the Treaty establishing the European Community, EU Charter of Fundamental Rights, Article 35, as well as Articles 168 and 169 of the Lisbon Treaty, and Principle 16 of the European Pillar of social rights.
Women with PIP are vulnerable. They are victims and they have been treated without dignity. Women are suffering from the pain, symptoms and trauma of PIP implants. They are frightened, not only because of media attention on breast implant cancer, but from their own first-hand experience and worrying symptoms.
Women with PIP are not being taken seriously by health professionals because of the sneer and sheer reports. They are not offered the most appropriate diagnostics, they are not receiving the best treatment or testing or biopsies, and in many cases are simply left to fend for themselves, as they are forced back into the unregulated private sector to pay for cosmetic treatment rather than having access to medical treatment they need. This utterly appalling situation has persisted for years now. Women must remove leaking and ruptured band PIP implants and need access to the appropriate healthcare, monitoring for themselves and their PIP exposed children.
The European Commission's behaviour towards women with PIP implants is not only a disgraceful abdication of duty, but an unforgivable attempt to deny women with breast implants their basic rights in favour of an industry grown rich on the exploitation of women.
Women in Europe have been waiting a long time for the announcement from the European Commission that obviating the dangers of PIP to human health, promoting research into PIP and BIA-LCL, as well as health information education will be forthcoming. In the same week, the SHIA Committee, the head of the European Commission's Medical Devices Department, Mr. Salvatore D'Acunto, and Commissioner Mr. Vytenis Andriukaitis all clearly indicated that no help will be made available to PIP-injured women.
Therefore, we are left with no alternative but to insist that the concerns are held in the highest court of the EU, where we wish to defend our rights and hold European Commission and the CE mark to account.
We look forward to your earliest reply.